So, Dr. Gebbie, I'm Hugh Tilson still, in case I need to introduce myself after over 30 years of friendship. And I can't believe that we finally have captured you in a room. I mean, you're so busy and overall everywhere for this interview. Thanks for joining this series. This is Profiles in Public Health Leadership. Lord knows you qualify. You have the best profile I know. And a leader in every way I can think of. Kristine Gebbie, thank you so much for joining me at this University of Kentucky Center for Excellence in Public Health Workforce interview, because we're going to focus on your work in public health workforce. This is about public health workforce and how the kernels of that as a research career were planted. And one of the things that you just said reminds me of one of the attributes of your thinking that I've always loved, and that is you're not just a systems thinker, but one of the other signs of a leader is to understand the resources at her disposal. And of course, in the system, the resources to work on a problem are multidisciplinary. So workforce suddenly becomes a key element of this thinking.
Absolutely. And although the state statute had undergone a change and the Oregon local public health agencies were not bound by who should run them, in fact, habit of 50 and 75 years said whoever has MD after their name must be the senior person in the agency. So we had this little bitty health department scattered around Oregon where Doc Snerdlap came in for 2 hours a week at best, and Nurse Jones or Sanitarian Smith was there 40 hours a week, making almost all the decisions.
But having the indignity of a 2-hour director, often so somebody was retired.
We changed a couple of forms and just said, this slot is to be filled in by the person who is there running the agency day to day, regardless of their discipline.
Oh, so the nurse in you didn't say it has to be a nurse.
No. We just said, whoever's running this joint, sign here, and that's who we'll start communicating with. And started a transformation of the leadership workforce. And then set up some regular meetings of those folks. We never neglected the physicians. I think we were very careful about how to treat them, but also very careful how to treat each of the disciplines in public health so they would come together and work together. What that also meant was not necessarily automatically assuming one. I was in very bad reputation with the public health dentists of the world for a very long time because I looked at the resources we had and the program we ran, which was primarily, if you remember the name, Swish Swash.
I remember Swish Swash. It was great.
Topical
it was actually a pretty good program.
It was a very good program.
It didn't have fluoridation in the water.
It does not require a dentist to teach school kids how to swish wash.
Oh, really? You think a non-dentist could do that?
A dental hygienist is actually quite good at that.
Darn betcha.
And when our money got cut, because I arrived at Oregon's crash into one of its worst economic downturns, hello, welcome to the state, here's your budget, you need to cut it by 30%. Said, push comes to shove, I want Swish Wash to live, no more dentist, we'll let the dental hygienist run it. And that's the kind of decision making I got caught in as we tried to build a system that was viable in troubled times.
Third critical leadership dimension in your career is strategic thinking. I mean, that's classic strategic thinking, right? You know that you have to preserve the oral health program for posterity. If you can't do it with a dentist, then the strategist will say, well, what are the vital elements, and make the trade-off so that you have the nucleus to fill the cavity over time.